In this video, I'm going to talk about the hidden dangers of untreated sleep apnea, why CPAP compliance matters to your health. Sleep apnea is more than just snoring or waking up tired. It's a serious medical condition that directly impacts your heart, blood pressure, blood sugar, overall metabolic health. When metabolic health is screwed up, your whole system is gonna screwed up. So many patients are prescribed CPAP therapy and the gold standard treatment, but unfortunately, non-compliance is very common. Ignoring treatment has consequences far beyond poor sleep. So I just want to emphasize that. In fact, when sleep apnea is left untreated or when patients stop using CPAP, it becomes significantly harder to control hypertension, diabetes, obesity, and other metabolic diseases. So let's talk about how sleep apnea affects your body. During obstructive sleep apnea, the airway repeatedly collapses at night, leading to interrupted sleep cycle, drop in oxygen level, surges in stress hormone like cortisol and adrenaline, increased sympathetic nervous system activity. This cycle puts the body in a constant state of stress, which disrupts the delicate balance needed to manage chronic diseases. Sleep apnea and hypertension. Each apnea event causes a spike in blood pressure. Night after night, these spikes contribute to persistent hypertension that is often resistant to medication. And studies show that treating sleep apnea with CPAP reduces nighttime blood pressure surges and lowers the risk of heart attack and stroke. So non-compliance with the CPAP, it basically would lead to uncontrolled hypertension despite medication. And there was a video I put out, I think last week, where the patient is on 5 or 6 medication because he stopped using a CPAP almost a year ago. And I had to just talk to him that that's just not the right approach. So I'm going to be doing a repeat sleep study on him and then restart him on treatment with CPAP. Okay, so sleep apnea and hypertension, right? Now, sleep apnea and diabetes. Oxygen drops during apnea episodes, triggering insulin resistance. Poor sleep quality raises blood sugar levels and worsens glucose control. Patients with untreated sleep apnea often require higher doses of diabetes medication or insulin, but still have poor A1C control. Non-compliance with the CPAP leads to harder to control diabetes and high risk of complications like kidney disease, neuropathy, and heart disease. Sleep apnea and obesity. Sleep deprivation alters your hunger hormones. You have increased amount of ghrelin, which is a hunger hormone, and decreased amount of leptin, which is a satiety hormone. And this drives late night cravings and overeating and weight gain. Fatigue from poor sleep reduces motivation to exercise. So non-compliance with the CPAP means weight gain, worsening obesity, and even high risk of worsening sleep apnea. Sleep apnea and metabolic syndrome. Untreated sleep apnea creates the perfect storm of metabolic issues. High blood pressure, elevated blood sugar, increased abdominal fat, abnormal cholesterol, and triglyceride. This cluster of conditions with the metabolic syndrome greatly increases the risk of heart disease, stroke, and early death. Benefits of CPAP compliance. When patient uses CPAP consistently, your blood pressure improves, blood sugar stabilizes, A1C drops, weight loss efforts become more successful, energy levels rise, improving exercise, tolerance, and mood, and risk of heart attack, stroke, and premature death decreases. CPAP is not just about reducing snoring, it's a life-saving therapy that restores balance to body's metabolic system. Because when the body's metabolic system is disturbed, there's nothing you can do to save it, really. So overcoming barriers to CPAP. Many patients struggle with the CPAP due to discomfort, dryness, mask fit issues. But you have to keep trying different mask styles, nasal, full face, nasal pillow, until you find the right one. Use heated humidifier, gradual acclimatization. wear it for a short time, even during the daytime, so that you are getting used to it. Um, uh, and make sure that you have a sleep specialist who can troubleshoot any problem. The worst thing a patient can do is give up on CPAP. Non-compliance means ongoing damage to heart, brain, and metabolism. So here's my final thought. If you have sleep apnea and other chronic conditions like hypertension, diabetes, obesity, compliance with the CPAP is not optional. It is essential. By ignoring treatment, patients are not only harming their sleep but also making it impossible to control very disease that threaten their long-term health. So, message should be clear. Treating sleep apnea through CPAP compliance is one of the most powerful steps you can take to protect your heart, manage your diabetes, lose weight, live a healthier, longer life. That's all for today. Thank you for watching.